Hey, Dr. Guglin here, again from HyperFit MD Age Management Center in beautiful downtown Milford. Let's talk a little bit about hormone replacement therapy. The science has been done about this stuff, folks. There's a lot of myths out there, especially about replacement in men and women who have gone through andropause and menopause. The only difference between men and women is that women tend to go through menopause in about a year or so they feel the symptoms acutely. Men, we go through andropause. It takes us like 10, 12 years altogether. And we just get old, fat, and crabby, don't we? Well, part of this is really a system of very slow hormone withdrawal. And in the allopathic world, where it is considered perfectly normal for you to get to a certain age and then just completely fall apart, it's considered off-label to provide for you a level of hormone optimization that protects your heart, protects your brain, protects you from senile dementia, protects your muscle mass, protects your bone mineral density, etc., etc. Now think about that. Your personal physician thinks it's normal for you to go through your aging process without the benefit of the same hormonal milieu that you lived with when you were in your 30s and 40s. Give it some thought. Give us a call. We'll explain it all to you. Most of what we do here is myth busting, and I'd love to talk about it. 203-890-9777. Our website is hyperfitmd.com.